The reason that I reached out to you was for all of the years that I've owned dental offices, I have never seen consistency. Uh, one month you'll see 75 new patients, have a great collections month, everything seems great. Then the next month you see 10 new patients and have a terrible collections month, and so you just kind of go through life like this. I have tried several different types of things to try to stabilize my dental office, and have had multiple thoughts on how can we just get consistent. I know there's consistency out there because I've seen dental offices that had more of a consistent approach to life, and I hate going through life like this. And I finally just came to the determination that in order for us to be consistent, we have to have two things. Number one, we have to have our current patients always, coming back and just creating a stable base in our hygiene recare system. And so that's something that to me has become extremely important. I've always been a kind of a doctor-driven, as far as our production, I've always tried to market and find people that we could do big procedures on, and kind of ignored hygiene and just thought, whatever happens in hygiene happens. But I've gotten to the point where I feel like I want our hygiene to be just very predictable and consistent, because that provides kind of a foundation for us to add our doctor's production to. Plus maybe I'm less motivated to pound the pavement like I once was, and so I don't want to do huge amounts of production like I once wanted to. I want to do consistent amounts of production every day. And so I've just felt like if we have consistency in our hygiene and in our recare, then there's going to always be some patients that feed into the doctor's schedule from that. But I feel like we would always be like this unless we had a good flow of new patients who are looking for the types of procedures that really help make it easy for us to fill our schedule productively, and day after day after day have the types of procedures and the numbers of patients that we need, to not have to call the same patient that we've called 20 times to see if they're ready to do their crown, stalking the current patients. Anyway, I just determined quite a while ago that we need a certain flow of new patients. And so I researched in as much as I could to what's the best way that we can assure ourselves of a healthy flow of new patients day after day after day, week after week, month after month, and never reach a drought. Seems like there's always a drought after you've had good things going on. And so I found a lot of things about Colin and SmartBox and everything else on Dentaltown. A lot of people had good things to say, and so I looked a little more into it, and I just ultimately felt like if anybody could provide me with what I think is important, and that's the consistency of new patient flow and patients looking for specific types of procedures, that it would be you.
Previously, you had the landing pages that we've looked at and talked about before, the procedure-specific landing pages.
Mm-hmm.
How did you feel that approach worked?
I haven't been good at tracking things. I haven't had a good method to track things, but I always try to ask our new patients, how did you find out about our office? And very seldom do I have somebody say, I saw it on your website, or I found you on the internet. So I just giving you my opinion, this may not be right. I just don't think it worked. I think we created those landing pages and those, I've created websites, and I haven't created. Someone has created for me websites in the past. and you can almost fall in love with, oh, this is such a beautiful website, or this is such a great looking landing page. I love the information on it. I love the pictures on it, or whatever. And it just kind of floats there, and it doesn't really do you any good. I don't feel like our web presence is strong. And yet I know when I think about myself as a consumer, the first place I go when I'm looking for something is online. And so it's become very easy to find what I'm looking for. I think for whatever reason, the efforts that we've made in the past to have a commanding web presence have failed miserably, because I don't have people all the time saying, I found you online. And I know that people are looking online because that's what I do. So I don't think it's worked.
Perceptions, as we were chatting and going back and forth, what were your perceptions of what we offered versus maybe what somebody else offered in the dental website, dental online marketing world?
So to make sure I understand, what perceptions did I have of what sets you apart from other competitors of yours? Is that?
What did we do that, I mean, obviously we're sitting here, appealed to you more than what somebody else was doing?
You know, I don't know if I can put my finger on it. For some reason, you gained my confidence. A lot of times if you dig deep enough, you can start to uncover the mystery that's been covered up, that maybe somebody doesn't deserve your confidence. I've had multiple websites built in the past that if I could have dug deeply enough, I would have found that maybe this person didn't know what they were doing, or knew how to build a site but didn't know how to make it functional. The deeper I dug looking for, between you and other companies, what would ultimately accomplish what I really wanted accomplished. And that, bottom line is, we want our phone to ring with new patients who are looking for a dentist or Invisalign or cosmetic makeovers, whatever. I couldn't find any reason that you weren't the best option. I looked into several different things. In fact, I've spent a lot of money in the past, as probably most of your clients have, trying to find somebody who could accomplish that one basic thing for me, make my phone ring a lot. And all the testimonials that I heard of people who had used you, all the threads that I read that talked about you talking on the phone to doctors who were contracted with you, or you with them, or however that works, just built my confidence more and more that of all the money that I've spent in the past and been frustrated that I didn't get what I was looking for, or of all the prospects that I've seen that are out there, because there's a lot of people saying we can get your phone to ring, when really they probably can't, or they can a little bit. But for somebody like me who's really looking to grow their practice significantly, I don't want to grow my practice 1% per year for the rest of my life. I want to grow significantly now so that we can always have a real strong practice. I felt like the more I looked into SmartBox, the more my confidence was built that if anybody could get our phone to ring and help us to have exponential growth quickly, it was you.
Was there anything that wasn't included in the systems and the packages that we sent over that would have been nice or would have been a good addition? Anything in your mind that was missing?
From my point of view right now, we're still in the beginning stages, obviously. It would have been nice to have kind of a time frame so that I would know, okay, here's day one, here's the day we're making our first payment, and so from day one, here's what you can expect will be accomplished in the first month, the second month, the third month, just, because I don't build websites, or I'm not a marketer. It's hard to know. It's kind of like a patient of mine coming in, and I know exactly what the process is going to be from start to finish to do a crown, for example. I know that they're going to have one appointment to do the prep and take the impression, and they're going to wear a temporary for a few weeks, and then they're going to come back and wear a temporary. So to me, that's just crystal clear in my mind, and it's easy to make the assumption that I know it, and so you must know it too. And the patient comes in thinking, I'm getting a crown today, and then I'll be done. And so I guess it would have been nice to have included in the package, here's where we are on day one. Your website will probably be completed and live at this point, whether it's 1 month, 2 months, 3 months, just to kind of help me to know. I sent you an email or two that was kind of panicky there at first because, you know, it's just the unknown. I'm going, well, I'm paying this money, but I wanted my phone to ring, and I don't see that we're there yet. How long is it going to take? I mean, you know, it's just nice to know instead of guess. Usually marketing is kind of expensive, and so, you know, from a business owner's point of view, you just don't want to be in another disappointing situation. You know what I mean? You've been here 1 or 2 or 3 or 4 times before, and I was just determined that this time around I wanted it, number one, to be the most effective way that we could possibly do it, and so I was willing to spend really whatever money we felt was appropriate to make that happen. But number two, I just was really, really hopeful that it wouldn't be another disappointment. You know what I mean?
Do you know the Summit Practice Solutions guys? Have you heard of them?
I have heard of them, but I don't know anything about them.
I was on the phone with Max, one of their principals, when you came up the stairs.
Mm-hmm.
And Max said to me on the phone he was talking to some new grads, or gave some kind of speech to a group of new grads or something along those lines. And he said, if you want to do well in dentistry, pick a small town and open up shop. And he said one of the kids looked at him and called him a crazy old man. And Max he's all white, you know, he's got the crazy hair, but he's a really sharp guy. He said one of the guys said, oh, you crazy old man, I'm gonna go to the big city where all the patients are, where everybody's got the money. And he said, I wish I could impress upon these kids, if you just go to a moderate town, a small town, get one doctor to 1,000, 2,000 patients, versus one doctor to 200 patients, you do real well. You know, I haven't looked at your ratio here in Grand Junction, but I venture to guess that a small town like this, it's probably pretty good.
You would think that, ironically, because I grew up in Grand Junction and I knew one dentist, the one I went to. I would have thought, coming from Phoenix, where there's 5 billion dentists and, you know, about that many patients too, when I found this practice was for sale and we started pondering, gee, Grand Junction, I never thought I'd go back and live in Grand Junction again, but why not? I thought to myself, I wonder how many dentists are in Grand Junction. And so I looked it up, and you know, Grand Junction has about a 60 to 70,000 population in Grand Junction, and the outlying areas it gets it up over 100, but about 100,000 for the valley. And it turns out that there's over 100 dentists here, and I was like, what? In Grand Junction? And so the ratio is not as good as you'd think, but if there's one thing I've seen, having been here for only 2 years, December 1st is my 2-year anniversary, is something that I learned way back in dental school. I think, you know, the Pride Institute, they're probably like Summit Practice Solutions. Anyway,
Okay. Yeah.
So Dr. James Pride was, UOP did actually probably a better job than most schools of hiring practice management companies to come in and try to teach us part of the business side of dentistry. So Dr. James Pride came in and said, let's see, I've lost my train of thought now, but we were talking about ratios of patients. Oh, he said, you know, no matter how the market looks, there's always room for a good dentist. And so, you know, we came in and I mean, you hate to say that because you're tooting your own horn, but I have felt like in just the 2 years that we've been here, I've seen that even though there's over 100 dental offices and only 100,000 people, so 1,000 per dentist, there's always room for a good dentist.